going to go ahead and start the recording. Before we get started, I do want to do a little introduction of who we are and what our purpose is. So the purpose of the INS Latino Community Task Force is to be the voice of the community and advocate across different sectors in North Carolina. We have three main goals: to be a multidisciplinary task force focused on Latino and marginalized issues. Second, to intensively collaborate with local community partners, community members, and federal and state representatives to educate the communities on the resources and any up-to-date news available. And lastly, to engage in our role as leaders and have consistency in our work. So this morning we do have a special guest, two special guests. So I would like to introduce our two speakers, Portia Pope, Dr. Portia Pope, and Carolina Cecilio Perez. So a little background about them is Dr. Pope is the acting director of the Office of Health Equity. She has over 20 years of experience directing state programs in North Carolina and California, supporting vulnerable populations and promoting mental and emotional well-being. She holds a PhD in leadership studies, a master's degree in public administration and early childhood education, and a bachelor's in social work. Portia is also nationally certified in various management disciplines and a published author on leadership. Carolina is the Latinx Hispanic Project Manager at the North Carolina Department of Health and Human Services. She brings extensive experience in community engagement, public information handling, and intercultural communication. She holds a master's degree in liberal arts and science and a bachelor's in English language and literature. She is committed to inclusivity through her work and creative writing. So I would like to introduce our guest speakers, and I will pass it over to you guys. Thank you for joining us this morning.
Thank you. Carolina, you want to open this up?
Yes, good morning. Is our screen, is our PowerPoint up? I don't see the screen.
Yes, sorry.
And I am going to drop a link to our strategic plan, which we'll be discussing this morning. I'm going to drop the link to the English and the Spanish in case anybody wants to make reference to it afterwards as well.
All right.
So, well, we want to definitely welcome everybody. We're going to be talking about our 2024 to 2026 strategic plan. This plan covers the department's strategies and goals for the next 2 years. It also talks about our COVID-19 response, the importance of focusing on whole person health, and the overall improvement of the well-being of all North Carolinians. Next slide, please. Our first goal is to advance health by increasing opportunities and outcomes for people who face greater health and situational challenges within NCDHHS and across the state. Our objectives are the ones you see here on our screen. It's to support local capacity to overcome persistent health inequities, use data to hold ourselves and our partners accountable, mitigate barriers to access health services, and increase the capacity of our partners to overcome persistent health disparities. And as we give you all a broad overview of the strategic plan, this is an important time to think through some of the objectives. We'll have room for questions after our brief presentation, and also Dr. Portia Pope will be helping us understand a little bit more about the Office of Health Equity, which we are both part of, and how we interact with the strategic plan to support our community, particularly in this case, also our Latinx and Hispanic community here in North Carolina. So
Before we go to the next slide, thank you so much for that, Carolina. And I'll just take a moment to level set to talk a little bit about the Office of Health Equity. Many of you may remember back in 1992, the North Carolina General Assembly established the Office of Minority Health and Health Disparities within NCDHHS. So we've been around for almost 40 years. The mission of this office is to reduce health care disparities between racial and ethnic minorities and underserved populations. It was in 2021, as a result of COVID, that the department established the Secretary's Health Equity portfolio, with this first Chief Health Equity Officer to champion equitable outcomes across the state. So within that portfolio, we have our Office of Rural Health, a new office, the Office of People, Culture, and Belonging, and the Office of Health Equity. And with that being said, as we go through this strategic plan and the objectives, you're going to see equity interwoven throughout all of our priorities. Carolina?
What? Our second goal is to promote child and family well-being by making it easier for children and families to access the healthcare programs and support they need. We hope to accomplish that by strengthening the capacity to meet the behavioral and mental health needs of North Carolina's children and families, reforming North Carolina's child welfare and social service systems to improve child outcomes and safety, and to improve nutrition security for children and families. Also by improving women's health and birth outcomes. And when we think about, for example, improving women's health and birth outcomes, we would think about advocating for bilingual prenatal and postnatal care and community health worker programs. So again, as we go through these objectives, we have some programs, for example, going on now, like Sunbucks, which is another initiative that helps us carry out these objectives. I don't know if I can see everybody by a show of hands, but we can talk a little bit about some of those programs. Another program you may be more familiar with as of recent is Medicaid expansion. And as we move through these objectives, you'll see where language access also plays an essential role in helping us carry out this information and service to the different community members in North Carolina. Next slide.
Carolina, before we start the next slide, I want to kind of build on what you just shared. Some of the other things that are taking place that are related to child and family well-being and just the overall economic well-being of children, families, individuals, our constituents across the state. Most recently, the governor, the legislator, and our secretary, Cody Kinsley, had a news conference talking about the new program, Healthcare Access and Stabilization Program. And this is a program that's going to support hospitals to eradicate or relieve $4 billion worth of debt that people across the state have for old hospital bills. So with this new legislation, it's going to help provide some of that relief for hospitals, but most importantly, it's going to provide relief for those that may be challenged with trying to pay for hospital bills amid taking care of your daily expenditures that you have just in your regular life every day. So we're really proud of the Healthcare Access Stabilization Program. It's called HASP, which is going to bring billions of federal dollars into the state to help mitigate medical debt for North Carolinians. As Carolina also alluded to, which is very important to our strategic plan and all North Carolinians, with Medicaid expansion, we started with the goal of 600,000. We're over 500,000 enrollees enrolled in this program. This Medicaid expansion also brought more than $4 billion to the economy, created 40,000 new jobs, helped control private insurance premiums, and just brought a plethora or huge amount of benefits to our state. Carolina talked about child and family well-being, and one of our programs being the Sunbucks program. This was an important program for us because it continued to provide food and nutrition services to children while they were not in public school over the summer months. And we're going to drop in the chat information about that program. That program was available to children that received free lunch. They were automatically eligible for those Sunbucks or those additional stipends to help purchase food during the summer. So very proud of that, along with the behavioral health investments that we're making, along with child and family well-being. And we're going to entertain some of the questions that you may have about the programming and what we're actually doing to implement programs to address the objectives within the strategic plan. Carolina?
Thank you, Portia. I think we can move on to the next goal, goal number 3. Okay, so goal number 3 focuses largely on promoting the behavioral and physical health of North Carolinians. It discusses objectives that help expand access to behavioral health support for those involved in the justice system. Also, the importance of increasing access to crisis services. As some of you all may be aware, we do constantly talk about 988 and the importance of the utilization of that line. And also an important factor to this is turning the tide on North Carolina's opioid and substance use crisis. And how does this all connect? If we recall from the previous goal, we're talking about data and really trying to understand better how the opioid and substance use crisis continues to affect, for example, in our case, the Latinx and Hispanic community in North Carolina. And of course, improving behavioral health data in the infrastructure and utilization of that information to create more sustainable programming.
And Carolina, I'd like to add to that. As you all know, the residual effects of COVID-19 has been unprecedented in terms of the stress and just the basic exacerbation of mental and behavioral health across our state. And to build resiliency and to ensure that we had a coordinated approach and systems to address these issues, we have a significant financial commitment of $835 million to improve mental health services. Carolina identified some of the key components, but I'd like to go even further. In addition to helping those individuals that are experiencing mental health or substance abuse crisis, we're also going to help those individuals to help avoid incarceration where needed. Carolina mentioned the utility of our 988 line. But most importantly, we also have funding to help serve children with complex needs, also support for their family, and strengthening our behavioral health workforce, ensuring that we have a workforce that's diverse in terms of ethnicity, diverse in terms of language. We know from the research that most importantly, as service providers, particularly in public health, that when we're working across communities, that communities respond more effectively when they're working with qualified providers that look like them, that speak the language that they speak. In addition to these areas, we're also teaming with across the state to make sure that we reduce the number of people that are institutionalized and ensure that they have an opportunity to live and play and experience in the communities that they seek to as part of our Olmstead plan. And we'll drop some of the information about the various plans and programming that we have across the state in the chat box. Finally, I want to end up with just a little bit of data. We knew that about 36% of our Hispanic population received mental health services in 2021, comparatively across the state. With this being said, the $835 million investment that we have in the state is to help us expand that behavioral healthcare access to ensure that there's an opportunity to reduce disparities across millions of racial and ethnic minorities across the state. So a huge pledge in terms of the programming, the policies, the objectives, as well as the funding to execute those for all of North Carolinians. And Carolina?
Slide, I'll discuss goal number 4. And goal number 4 is building a strong and inclusive workforce, developing a workforce and pipelines and career pathways. I know in these spaces we often talk about expanding our capacity with individuals who can either serve in mental health professions and medical professions and public health professions. So it's definitely about stressing the importance of creating educational and career pathways for Latinx and Hispanic individuals. It's also about investing in early childhood workforce to expand access to high quality and early care and educational programmings, and to lead by example as an equitable workforce that lives its values and support our public health and child welfare workforce at both the state and local levels.
And I'll chime in and talk about a couple of programs that we currently have. One of the programs is our historically Black colleges and universities, as well as our minority serving institutions internship program. We call it HBCU/MSI. This year we had about 43 interns, students from across various higher education entities in the state that are interested in working in public health. And this is an exciting opportunity to help us create that pipeline as we promote that program next year. If you know of any students, graduate students, or undergraduate students that may be interested in participating in this program, please reach out to myself or Carolina, because we're constantly looking to diversify even within those approaches. Secondly, we're very proud to say, as an Office of Health Equity within the Office of the Secretary and the portfolio, that we are also working with community providers and community stakeholders to help us kind of help inform how we identify our leadership for some of the work that's done in our Latinx policy and strategy programming. And very thankful to just a variety of individuals that work in this with the Latinx population, who have been very instrumental in helping us identify our staffing to make sure that we're making a decision in tandem and in partnership with the community. With that being said, we are in the process of looking at our Latinx strategy and policy director. Many of you worked with Jasmine Rico for many, many years. We are in the process of ensuring that we do have staffing in that position, as well as some additional positions to support the work going forward. One of the most important things I want to say about a strong and inclusive workforce, as we think about mitigating disparities across the state, this work for the Latinx, Hispanic, Latino community is important to all of us. So moving forward in how we change the trajectory of the outcomes, you're going to see more people from the Office of Health Equity supporting this work. For example, myself and other members of our team, you're going to see us in your communities, you're going to see us at your meetings, because we also want to understand firsthand how we can culminate the work that's being done for millions of individuals that belong to this population across the state, that we're providing the most high quality care, services, and programming in partnership with leaders across the community. So I look forward to that work, look forward to partnering with you all as we go forward in championing, health outcomes and mitigating disparities for all in the state. So thank you. Carolina?
Well, I think that we can move on to the next slide, which is our fifth goal. And I think, Portia, what you just shared is so important in really helping us achieve operational excellence by enabling efficient, effective, and innovative processes and service. And you definitely need that by starting with an inclusive and a community work and a workforce that reflects the community, their needs, their languages, their lived experiences. But then there's also the effective stewardship of the state resources you just mentioned to foster a culture that enables the continuous review and improvement of department processes and services. And one way that we invite community to help us do that better is through our community partnership engagement, which is also something that the Office of Health Equity is helping stand up, helping streamline so that we have more open lines of communication to hear from community, hear their input, have them be more involved, and ensure that NCDHS continues to be staffed and organized to meet the goals and sustain a quality services. With that being said, for this team and this group to know, the health disparities report will be released here in the coming months. That is something that we have strived to work on with the Office of Health Equity, and also ensure that there's a simultaneous release of this report and information in English and in Spanish. And so that's something that you all can look forward to seeing, reviewing, and at that point, we will also continue to welcome insight and feedback as we continue to learn and grow in this process together.
Thank you, Carolina. And we also have a second report, and it's called the Health Equity Report from Medicaid, which is going to be released. I'm sorry, it was released last week, and we'll also ensure that you have a link to that report. So these are two important, very important reports for the state. One, looking at how we are mitigating disparities across Medicaid, and the second one looking holistically at disparities that exist in the state. Couple of things I want to just say. In terms of Medicaid expansion, we had a goal of about 50,000 individuals from the Latinx, Hispanic, Latina community that we wanted to enroll. We are almost at 46,000 in that number, and we'll continue to work until we reach that 50,000 until the next iteration of services are available. Secondly, I wanted to just lift up the fact that it's going to be important for us as our health disparities report is unveiled, where we're looking at access to healthcare, chronic disease, heart disease, kidney disease, diabetes, as we look at social and emotional well-being. All of these things that resonate with us every single day, our communities, our families. It's important that we partner with you and other organizations as we look at the solutioning to these wicked problems and what we can do in partnership in tandem to address them. We have a really good model with our state health improvement plan where we have thousands of individuals that are working with us across the state to help come up with solutions. And it's important that we have those lived experiences and divorce perspectives at the table that are really culturally relevant to the community, that we're not developing interventions and services that we think are appropriate in the absence of the community. So that ongoing partnership is going to be very important for us. Additionally, I just want to say, looking very optimistically at the future and what we're going to be able to accomplish together as a team. Thank you so much for this invitation and the opportunity just to speak and engage. And I look forward to doing this much, much more with you as we work on solving North Carolina's problems, but also as we work on ensuring that the investments are reaching far and wide across our state. Thank you.
I think you're muted.
Thank you. So I want to say thank you to Dr. Portia and Carolina for joining us this morning and sharing this great presentation with us. So we will move on to comments and questions. So you're welcome to unmute or raise your hand. And I will check the chat box to see if there's any questions. And if not, I think Juvencia, if you want to get us started.
Thank you, Dr. Porch and Carolina, for this great presentation. As Marlene stated, this is a great presentation, and I hope the members of the NC Latino Community Task Force really engage with the office. I think it is for the first time in the history, we really share on a strategic plan, and it's very broad to engage the community across the state, and the portfolio that really reflects what we've been talking about for the last 3-4 years after the pandemic. So I think this is an opportunity for you guys to really engage and ask questions or the comments is to build in this strategic planning. One of the things that's so amazing to see is the really intentional integration approach that I think is needed in the state, and it needs across the United States. You know, the diversify the workforce, I think is important. You know, the program that you're talking about, you know, bringing those opportunities for internship programs. I think if we continue to leverage that to engage other populations, I think it will be great. To me, I said, this is an investment that we can make to our young people and future leaders of agencies like DHS. You know, I think that model that needs to apply across the board with the different entities, offering these opportunities for our young people to get in the public health field. And any other programs, you know, education, et cetera, et cetera. I mean, but I think this is a great opportunity. I just applaud for this effort and applaud for your leadership.
So we did get a question in the chat box. So From Lynn and Caro, in my experience, the Hispanic immigrants I encounter tend to be anti-bureaucratic, not liking filling out paperwork, going through formal processes, etc., and prefer to work through someone they know and trust, like a case manager or promotora that would help them access services and programs. Unfortunately, I think I have read that funding for community positions like promotoras is dwindling now that we are entering post-COVID. Are there any additional plans to reinforce this crucial aspect in the infrastructure of help for Hispanic families connecting to services and programs needed by NCDHHS?
Carolina, do you want to start with that one?
So I think the question is referring to our funding to continue to support community health workers and just the important leadership and personalized services they were able to provide. I don't know that I know of any extension to at this time for some of that programmatic support. Did you want to add anything, Portia?
Yes, I'm gonna also take the question back. I know we're in a post-COVID era. However, there were a lot of lessons learned from our CDC grants on services that we found would be very beneficial if we could continue. But let me take that question back. One of the things I can say, not speaking at the community level, but just speaking at the level in which we work in the Office of Health Equity, we are looking to expand how we staff our team that works in the Latinx Strategy Policy Department to ensure that as we look at these statewide issues, that we have ample expertise, diversity, lived experience across the board as we make these decisions. So, but I'll definitely take that question back and inquire. So this is community health workers.
Yes, and thank you, Lenny, for just bringing up the kind of that feedback of the importance of having more pathways, more direct services, and individuals with lived experience to really tailor some of the programming that we offer. I think the same is true even for the wonderful work I see Francisco on this call, the work and the information that he's able to bring county and city to city. That is so important for them to see that face, have that welcoming and warm touch when they're receiving this information, and maybe not just on a website or in a way that feels maybe bureaucratic, as Lennon shared in his comment. So thank you for that comment.
Thank you, Carolina and Dr. Portia. I did want to add, oh, go ahead, Juvencio.
Dr. Pope and Carolina, is you presented this framework or this strategic. Has been any conversation in terms about also looking at on a regional approach? Seeing the regions they're very different and across the state. Does any conversation has been looking to kind of map this on a regional approach? From rural to urban, urban to rural, and other areas.
It's so interesting, Horacio, that you mentioned that, because we had a strategic planning meeting about a week ago, and Carolina mentioned that to us as a strategy for consideration. So we are in discussions about that. So it's interesting that you mentioned it here. So I think we're thinking about this in the right way. So we'll definitely follow up with you as to where we land on that decision. But Carolina just mentioned this to us last week.
Yeah, because that's one of the things that we found when we did health equity summits across the state for the last couple of years. So we found that I think it's more beneficial to begin thinking about on the regional approach, because each region is so different and so unique. And so how we engage with those regional approaches, looking at the health equity in terms about the communities and engagement with the policymakers and engage with institutes and so forth.
Thank you. And I may be reaching out, Juvencio, to you, some expertise on that as well. And I've made a note of it. So thank you.
So I did have a question following up. I think it goes in line with what Lennon had mentioned. So how does the strategic plan propose to strengthen the infrastructure needed to support the behavioral and mental health needs of the children and families over the next 6 years? As Lennon mentioned, the Hispanic community tends to, be more in person or interacting. We have seen a big increase in need for mental health services within the Latino community. But I know a couple of months ago or this past year, there were some campaigns on mental health and suicide prevention and things like that. But we still saw that the community wasn't reaching out to those centers or reaching out to receive that support. Is there anything in plan for the next 6 years on how they could be more engaged or be more open to using those services?
I think one of the things that may be important as we move forward is to expand who speaks at these type of forums. Because over at our Division of Mental Health and Substance Abuse Services, they're doing some phenomenal work, like I said, across this $835 million investment. And maybe at the next meeting, we could ask Ms. Crosby, who is the division director there, or someone from her staff to specifically speak to what you just posed in terms of your questions, because we know right now we're working a lot on ensuring that we have programming for children in foster care, that we are addressing the emergency room situations where children and families are presenting for mental health issues. We also have our tailored plans. We have so many things that are going on, but to specifically narrow this down to how these impacts are reaching the Hispanic and Latinx community, I'm going to ask my colleague to also come and present and answer any more specific questions that you may have that are directly related to that. So I'm going to take that back as well. Good question, and thank you for asking it.
Thank you. Is there anybody else who has any questions or comments?
We'll just add that at the beginning, and if you will have the opportunity to see and look through the strategic plan, the introduction of the secretary talks about the importance of whole person health and whole person wellness. And one of the things that when I was preparing this presentation, one thing I realized is we give a lot of examples of, for example, food security and access to transportation and access to childcare. But what I think is really important for us in groups and spaces like this to also continue to bring up is the security aspect, right? What does our community need to feel safe? And a lot of times that has to do with immigration related concerns, with mixed status households and documented families, and really just the importance of highlighting that that is an aspect that really does intervene with the quality of life and access to health services. If you don't feel like you can safely travel to a doctor or safely seek mental health services, or can afford to because you're uninsured, because you don't have access to Medicaid because of the reasons I just mentioned, that is a significant barrier to whole person health and wellness for all these families that we continue to advocate for and represent, and find, that's something that I would like to see enter the conversation a little bit more, just so we can understand that we're dealing with a very different community and a very different population sometimes in terms of what might work and how to best approach those interactions.
Thank you, Carolina. So if there's no more questions or comments, I want to thank you again for joining us this morning. We appreciate it, and I will be sharing that link in that text that you just shared in the chat box, Dr. Hope. We did get one more question from Carrie. Can you speak on any specific strategies or tactics you have in mind for building a workforce of Latinx behavioral health providers? How will curricula be improved and be culturally responsive? Will these strategies only relate to HBCUs or MSIs, or will they be rolled out across the board? Will they only require to technically licensed professionals, or also the types of community positions that have been mentioned?
Very good question. The internship program is just one work stream that we have employed. Juan Ortiz in our office is our cultural competence manager, and this is some of the work that we are having conversations on with a broader community, because as you know, this is definitely strategies that will involve many partners from higher ed, health institutions, etc. So give us an opportunity to kind of outline how we're going to approach that. However, with that being said, that's from our office, the Office of Health Equity. But within NCDHHS, there are some definite initiatives that are going forward to make sure that we do have a strong and inclusive workforce. That's why it's a part of the strategic plan in terms of the actions that we're taking. And I will collect more information across different aspects of the department so that that information is widely available to you, as well as share what we're going to do in our cultural competence work stream to address the issue as well.
Thank you, Dr. Pope. We did have one more question. Is there any documentation of the impact of long COVID diagnosis with Latino population and use of technology like COVID apps that were designed by NCTHHS?
I am not sure of the answer to that question, but I am going to copy some of these questions out. We still currently have a response COVID. Well, it's not necessarily COVID, but it is with communicable disease, COVID, flu, RSV. We convene monthly, and it's led by Dr. Moore. So I will definitely take this question back, get a response, and see if I can share that information broadly and widely with the group. So I'm going to copy it and get that information back to you. Thank you.
For the particular question, Marlene, and maybe it will be a good opportunity, Dr. Pope and Carolina, to bring somebody from your office. I know what Jasmine used to be work for the agency. She used to talk about that in her presentations, and I think there's some. I think last year, Donna Marlene, that she talked about how the impact that connections with the apps and internet and all that, how the community really benefit, and it's very high.
Yes.
It's very high the engagement that community, the Latino community has.
Thank you. I took a note of that as well. So if that's it, I'll do one last call before we move on. Okay. So again, thank you. I hope you guys have a great day, and we really do appreciate you joining us this morning. We do have about 15 more minutes, so I do want to give time for people to share their updates, and as well as Mexican. So I will quickly go over the upcoming events that we have here this month. So tomorrow, August 13th at 11 a.m., we are going to be having a town hall as part of the NC Latino Advocacy and Civic Engagement Network. It will be via Zoom, and my colleague will be entering that information in the chat box. This Saturday, we have a back to school event in Pitt County at Welcome Middle School. It will be from 11 to 2 p.m. and you guys are welcome to join if you haven't signed up already to host a table. We will also be having a mental health webinar on Tuesday, August 20th in the morning at 11 a.m. via Zoom, and then we'll have a Spanish one at 7 p.m. that same day. Our next NC Latino Resource Network meeting will be August 27th at 10 a.m. Information will be shared as well. Back to our NC Latino Health Alliance, we are going to be having a second mental health Spanish webinar at 7 p.m. on Tuesday, August 27th. On Thursday, August 29th at 6 p.m., we're going to be having a taller informativo binacional. So we will be working with our Mexican Mexico team to be sharing a presentation with you guys. This is also via Zoom. Our offices will be closed September 2nd for Labor Day. And then lastly, our Pitt County Despensa will be on Friday, September 6th from 4 to 6 p.m. at the Mexican main office. And then I'll move it on to introductions. So I'm going to go down the list. If you could please give your name, title, and any upcoming events or updates that you'd like to share with us. So first I have Angela Bird. Good morning, Angela.
Good morning. How are you all today?
Good. How are you?
I'm great. My name is Angela Bird, and I am the Family Care Coordinator for Edgecombe County Healthy Start Baby Love Plus. And for those that are not familiar with Baby Love Plus, It is designed to ensure that all the babies live past their first birthday and to improve the health and of the women and the babies. And we provide a wide range of health services and other services, such as help the mothers and match them up with the services that they could use to help them help their babies and themselves, which could be like stable housing. We provide preconception information, education, and we also provide health care information between pregnancies. And this is done by improving um, the parenting skills of the parents and promoting health through education and counsel. And this is what we do with Baby Love Plus to try to make sure that we have healthy moms that have healthy babies.
Thank you so much, and thank you for joining us this morning. Next, I
Thank
have
you.
Brenda Robertson. Good morning, Brenda.
Good morning. My name is Brenda Robinson Caney. I'm an office manager in North Carolina certified paralegal with Legal Aid of North Carolina. I'm also the community outreach coordinator. Legal Aid of North Carolina is a nonprofit law firm serving low-income people in civil law matters. And we serve all 100 counties in the state of North Carolina. In our office, which is in Hosky, we serve all the 11 northeastern counties. Feel free to visit our website to find out more about Legal Aid of North Carolina, and we look forward to any type of referrals that your organization would need to refer clients for legal assistance. Thank you.
Thank you, Brenda, for joining us this morning. Next, I have Carlotta Dixon. Good morning. Now we'll move on. I know, Carolina, you presented, but I didn't know if there was any other additional updates that you'd like to share with us.
Thank you. Yes, I'm going to drop at least the link to our latest newsletter and also the Medicaid expansion cafecito that we had last week. Stay tuned for more information, and don't forget that the Sunbucks deadline is coming up on August 31st. Thank you.
Thank you, Carolina. Next,
And
Uh-huh.
I'm sorry, I did put some information about Sunbucks in the chat, where you can send a text for more information. So thank you.
Thank you, Dr. Pope. Next, I have El Consulado General de Raleigh.
Hi, everyone. My name is Benjamin. I work with Monica in the Community Affairs Department, but we don't have any upcoming event during this month until the September 16th. That is the National Mexican Party.
Thank you. Thank you for joining us this morning.
Thank you for sharing.
Next, I have Hector Denoise. Good morning, Hector.
Hi, good morning. My name is Hector Denoise with Environmental Protection Agency in Region 4 in Atlanta, and I don't have anything to share for this.
Thank you for joining us this morning. And next, I have Raj. Good morning, Raj.
Hi there. Hey, thank you, Marlena. No, I don't have any questions. Well, thank you for the meeting. We do health education using technology such as EKG. And what we found is long COVID, can be easily mapped to the orthostatic test we do. So we are interested in maybe participating or helping anybody that is wants to work with the patients who are doing long COVID. We can give them referrals to clinics. These are online clinics that can help with long COVID symptoms. Thank you.
Thank you, Raj, and thank you for joining us today. Next, I have Francisco Guzman. Good morning, Francisco.
Hola, good morning, everybody. I'm putting some information in the chat. We will have the Governor's Advisory Council for Hispanic and Latino Affairs. And this time we are going to Wilmington. Some of us on this call, we are going to be part of that meeting. If you guys can attend it, the link for for in-person is there. It's going to be in Wilmington. You can spread the voice to your colleagues, to the community. And as well, we have an online version. This online version, in case you cannot drive until Wilmington. And Marlene, I'm going to put in the chat, there is found opportunity for some organizations regarding special healthcare needs. Maybe you may read and you guys and your organizations may apply to this opportunity. Thank
Awesome.
you.
Thank you, Francisco, and I'll share that in the newsletter as well. Next, I have Glorstein. Good morning.
Good morning. My name is Glorstein Smith, and I'm with the Edgecombe County Health Department Healthy Start Baby Love Plus program. And I work alongside with Miss Angela Bird as a family outreach worker. And it's so nice to meet all of you today.
Thank you for joining us.
You're welcome.
Next, I have Irlanda Ruiz. Good morning.
Good morning, everyone. Buenos días. Mi nombre es Irlanda Ruiz. My name is Irlanda Ruiz. I work as Hispanic Disability at the NC Council of Developmental Disabilities. With Francisco, on Wednesday, we're going to have an event in Wilmington to let their families there about what is the council. And if you know families who have children with disabilities or persons who have disabilities, they can be that we can reach out. We will appreciate. The meeting is going to be at 6 p.m. So I'm going to put some information in the chat, and you can also reach out to me as well through my email, irlanda.ruiz@dhsnc.gov.
Thank you for joining us, and thank you for sharing. Next, I have John Kozoya.
Osaya.
Perdón, sorry.
No te preocupes. Yes, hello everybody. I'm Jonathan Kasaya. I'm with Carolina Complete Health, and I'm a community health worker. First time here. Thank you for Francisco for inviting me. The only two events that we have currently that those are slated for September 24th. We have a health fair event at the DSS office. That's September 24th from 10 a.m. to 1:30 p.m. And this is for all people to come in and hear from all the health plans. That's for Mecklenburg County. And then we have another one on September 20th. That's for Cleveland County. It's the same thing. It's a health fair where all the plans come together and we offer service. I mean, we offer information about the services that we provide for Medicaid recipients. That's it. Thank you so much.
Thank you for joining us, and thank you for sharing as well. Next, I have Carrie Brock. Good morning, Carrie.
Hi, everyone. Good morning. Thanks for having me. I'm Carrie Brock. I'm the Associate Director at El Futuro in Durham and Siler City. And I dropped in the chat a couple of links, one to our webinar that will be coming up in October. And also we'll have our biannual La Masita Latino Mental Health Conference coming up on September 26th and 27th. And I dropped a link in the chat for more information on that and how to register. Thanks so much.
Awesome. Thank you so much. And thank you for joining us this morning. Next, I have Lennon Caro. Good morning, Lennon.
Morning. Thank you for the presentation today. I don't really have any updates other than if you want to know about the progress of our statewide Latino Strength and Needs Assessment, I put in a heat map that shows how many surveys we collected across the state by county. We're sitting at around 3,100. So I'm actually writing down events because I'm trying to find festivals and health fairs that I can go to table at so I can get more representation in the East Coast. So if there's any events that you guys have that might be a good idea, feel free to message me. And also I dropped in a link of our latest report on Western North Carolina. We collected over 500 surveys over there, and I just wanted to make sure you guys had access to the report. Thank you.
Awesome. Thank you for joining us today, Lynn. Next, I have Leo. Good morning, Leo.
Hey, good morning, everyone. Leo Scarpati with Blue Cross and Blue Shield of North Carolina. I'll drop my my email in the chat in case anybody wants to connect. We're always looking to see what great work organizations are doing across the state. I don't have any events at the moment, but thank you for hosting.
Thank you for joining us this morning. Next I have Phil Triplett. Good morning, Phil. If not, we'll move on to Saria Estrada. Good morning. And if not, we have Vicky Cruz. Good morning, Vicky. Oh, I think you're still on mute. Yeah, Vicky, I think you're still on mute.
Excuse me.
There we
Good
go.
morning. My name is Vicky Cruz. I'm working for Raleigh Immigration Law Firm, and I'm the coordinator of outreach. For us, it's very important, right? Be here because we want to know what happened with our community. But what we do is we're going around whole North Carolina, South in North Carolina, doing some presentations from our lawyer, Becky Moriello. And I go to doing some events, even a table information, right? So the community is really important for us. And I be around everywhere. Many people here, I think so, know me. So thank you for the invitation, and I'm happy to continue to be here because when I share information, I can share a better information if I know all those things that we talk here. Thank you.
Thank you for joining us, Vicky. And next, I will pass it over to Rodolfo to share a little bit more about the town hall we are having tomorrow.
Buenos dias. Good afternoon, everybody. I hope everybody's doing, oh, good morning. Sorry, 3 minutes early. I hope everybody's having a wonderful morning today. And I just wanted to come up here to talk to you guys about an upcoming community town hall. It will be taking place tomorrow at 11 a.m. Eastern time via Zoom. The meeting ID is in the chat, and it'll also be on our social medias, website, and in our newsletter. Our guest speaker is Mr. Bob Edwards, and he is running for Pitt County's Board of Commissioners for District B. So come and learn more about why he's running for office and the impact that he'll take on minority communities in District B. Everyone is welcomed, and I hope to see everyone there. Thank you.
Thank you, Rodolfo. And then with that, I will pass it over to Juvencio because we do have 2 more minutes left to close this out, and if he has any final comments.
I want to say thank you, everybody, for participating. Thank you, Marlene, for hosting these meetings on a monthly basis. Don't forget to follow us on social media. That's where we publish a lot of this information. I know we have some people here from Edgecombe and Nash County. We in conversation to host our second annual Health Equity Conference in the Northeast part of the state, which it will be in Nash County, Edgecombe County, but I think it's probably going to happen in Nash County. If you please send me an email so you can touch bases with you for the people out in the Edgecombe and Nash County area and let you know about the progress in terms of our next Health Equity Conference that we want to host up in Northeast. And with that, thank you. Have a wonderful weekend, and we look forward to collaborating with you on all these great initiatives that the community partners are hosting. Thank you, Marlene.
Thank you, Vencio, and thank you, everyone, for joining us. Have a great week.